Hey everyone, my name is Alexandra Evans. I am a MLT student, class of 2021 at Montlow State Community College. Today I'm going to be presenting you with a case study that's centered around the findings of hairy cell leukemia. So first I'm going to go over a little bit of background on our patient. This was a 36-year-old man. He presented to the ER with symptoms of an ear infection and some episodes of night sweats. Once in the ER, they performed a couple labs and he was found to have pancytopenia. This is just a decrease in your white blood cells, your red blood cells, and your platelets. He was then admitted into the hospital for a more extensive workup to be performed. This patient, it's also important to note that he had a history of testicular cancer at the age of 23. He's now post-radiation therapy, and since 23 has been in good health until he started experiencing these episodes of night sweats. So once our patient was admitted into the hospital, they started to perform some more testing. He was subjected to a viral testing for hepatitis B, hepatitis C, and HIV. All of these came back negative. After this, they started to do some imaging for acute and chronic sinusitis, and as well, it came back negative. After this, they did some more lab testing. They did a peripheral blood smear with angioscytosis, which is different sizes in your red blood cells. Ovalocytes, which are going to be your red blood cells are more oval. Polychromasia, this is when you look at that blood smear and you see those more purple colored ones. Then you have some teardrop cells within that blood smear, and these, like the name implies, they're shaped like a teardrop. Additionally, there were some atypical lymphoid cells, which are going to be very important in our diagnosis. These had a round nuclei, in addition with some hairy cytoplasmic projections. So here we have the exact CBC and peripheral blood differential for this patient. Some important things to look at: pay attention to the white blood cell, the red blood cell, and the platelet count. All three of these are notably low for what you would normally expect to see in a male. This, again, that pancytopenia, it's an important factor in our case study. If you go and you look down at that peripheral blood differential, you'll see his atypical lymphs being at 3%. This is not normal. This is going to be those round nucleus with the hairy cell production, which are going to play a really predominant role in our diagnosis. Other than that, you look at his other red cell indices, all within range. His other peripheral blood smears, they're about in range. What you can see here is that a picture of that atypical lymphocyte seen in the smear. Again, you have that round nuclei, you have that cytoplasmic projections called hairy because it kind of looks, like hair coming from the lymphocyte. All of these lab results led the doctor into thinking of the diagnosis of hairy cell leukemia. So what is hairy cell leukemia? Hairy cell leukemia is defined by the World Health Organization as a lymphoid neoplasm consisting of small, mature B lymphoid cells. These cells contain an oval nuclei and an abundant amount of cytoplasm with hairy projections. Again, like that picture we just previously saw. This disease involves the peripheral blood. However, that peripheral blood then permeates the bone marrow. The bone marrow is also going to be, a key place where we can kind of tell what's going on in the patient and if they do actually have hairy cell leukemia. So hairy cell leukemia compromises 2% of lymphoid leukemias. This makes this a relatively rare disease and it's primarily going to be seen in middle-aged to elderly adults. Hairy cell leukemia is often going to be associated with that pancytopenia that I recently talked about, and this is because the patients often are going to exhibit an enlarged spleen. And in our case study, the patient did in fact have an enlarged spleen, which did account for his pancytopenia. Since this enlarged spleen is something that's predominant in hairy cell, if there is a rare absence of it, it can lead to the misdiagnosis of aplastic anemia. For this reason, it is very important for the condition to be associated with an abnormal bone marrow biopsy. So let's talk about bone marrow biopsy and hairy cell leukemia. So when looking at a bone marrow biopsy, you're going to want to see a few key characteristics to associate it with that hairy cell leukemia. For example, you're going to see an increase in reticulin fibers with hairy cell in the bone marrow. This is going to result in a dry tap. And all a dry tap is the failure to obtain bone marrow aspirate. For our patient in this case study, he did have a bone marrow biopsy done while he was in the hospital, and it did in fact result in a dry tap. However, what was found in his bone marrow biopsy did still support the diagnosis of hairy cell leukemia. He had those lymphoid infiltrates that consisted of oval nuclei and that abundant cytoplasm, which kind of has a fried egg appearance if you're looking at it. The patient also had an increase in reticulin fibers. That was seen as his reticulin stain. Here we can see on the right the bone marrow differential for this patient. He had a 1.4% blast, a 0% promyelocyte, a 6.4% myelocyte, a 6.6 metamyelocyte, a 7.4% band, a 4.8 premature, a 0.2% eosinophil myelo and meadow, a 0.4% eosinophilic bands, 0% eosinophilic segments, a 0.2% basophil, a 1.6 monocyte, a 0% pro-normoblast, a 31.6% normoblast, a 39.2% lymphocytes, and a 0.2% plasma cells. It also shows the myeloerythroid ratio at 0.9. But in these lab results, the important thing to pay attention to is the lymphocytes. So the lymphocytes here, the percentage is a 39.2. This is well above the normal range and well above that adult mean that is typically seen. So another thing that can be done to help be sure of a hairy cell leukemia diagnosis is flow cytometry. Typically with hairy cell leukemia, it's going to present with a certain immunophenotypic profile. And this profile is going to be strongly positive for pan B cell markers, as well as being positive for CD103, CD11C, CD25, and negative for CD5, CD10, and CD23. However, it is still not uncommon for hairy cell leukemia to display an unusual immunophenotypic profile. Our case study that we are talking about today is an example of this that we will go over in just a second. But it's very important that you're able to recognize the difference in variety that the flow cytometry can present within hairy cell leukemia. This is going to help ensure a proper diagnosis of hairy cell leukemia so that we can properly treat the patient. Here are the flow cytometry results for our patient. They're displayed on the left here. You will see, it's different kappa chains and lambda chains and the different CD markers. For our patient, we had the phenotype observed. It showed the kappa light chain was restricted and the expression of bright CD19 positive, CD20 positive, CD5 negative, CD10 negative, CD103 negative, bright CD11C positive, CD25 positive, and CD20 positive. So although this patient was negative for 103, and typically with a hairy cell leukemia patient, you're going to want to see them as a CD103 positive, it's okay because the morphological findings and the flow cytometry findings and the other lab results are still enough to support the diagnosis of hairy cell leukemia, even though that one marker is different than what you would expect to see in a typical textbook case of hairy cell leukemia. So this is an example of being able to recognize the variation that hairy cell leukemia can present itself. Even though one of the markers is wrong, it can still be hairy cell leukemia. Hairy cell leukemia has a relatively good prognosis. There have been multiple treatment routes that have been established for hairy cell leukemia throughout time. One of the first forms of treatment for hairy cell leukemia included the removal of the spleen and alpha interferon. This isn't the go-to anymore. Now they're going to start with a treatment that is focused on analogs such as pentostatin and clozapine. This is definitely proven to have a higher response rate for patients. However, one downfall is they have started to notice that some patients are displaying a form of cancer that is starting to become resistant to this form of treatment. So they're becoming resistant to that medication and those analogs that they're putting them on. For our patient in particular, the doctor set up a treatment process starting with clozapine, and then following this, the patient was to maintain a Rituxan therapy. So far, this treatment plan has proven to be successful for patient. He is now in remission. Going back to what I had previously stated with the patient having testicular cancer at age 23, although he was in remission and, seemed to be healthy until he started exhibiting those night sweats, it's uncertain if that previous radiation played any kind of role in the hairy cell leukemia that he had been diagnosed with. There have been studies done that do show a possible correlation between radiation and hairy cell leukemia. These studies not only included people that had undergone radiation for previous cancers or health reasons, but it also included people that just had occupations that, put them around radiation. So these included chemists and healthcare workers and engineers. And it was found that, they did have a higher percentage that had hairy cell leukemia, they were exposed to radiation. There has not been enough research done to verify one way or the other and to stay with confidence whether or not this testicular cancer did play a role in him developing this hairy cell leukemia later on in his life. However, it is something to kind of look into and is interesting. So now a brief overview on this case study. So we had this patient, he comes in, 36-year-old man, he has low counts for his white blood cells, red blood cells, and platelets, and this was to be expected because he did have an enlarged spleen. So they admit him into the hospital, they do that blood smear, they see some abnormalities, some things that cause for alarm. One of the biggest things, though, when looking at his blood smears that caused an alarm was that presence of an atypical lymphoid cell with that oval nuclei and that hairy cytoplasmic projections. From this, they then decided to do that bone marrow biopsy. This also supported the theory that not all hairy cell leukemias present with the exact same immunophenotype, since his was negative for that CD103. However, with the bone marrow biopsy and all the other supporting testing done, they could still confidently say that this patient had hairy cell leukemia. All of these labs resulted in the doctor being able to properly diagnose this patient with hairy cell leukemia and then form a treatment plan that ultimately led to the patient achieving remission. Here is the case study site where I found this case study if you want to do any further research or read any more on it. I hope you enjoyed my case study and I hope you were able to learn a little bit more about hairy cell leukemia.